Hello, and thank you so much for tuning in today. I have two guests with me on this episode, which is really exciting because one guest is going to share the science behind a specific type of therapy, and the other guest is someone who has been using this therapy, and she is going to share all of the benefits that she's noticed from it. One of our guests is someone you might already know from FUMS. Her name is Kathy Reagan Young. She is a prominent patient advocate and the founder of FUMSnow.com. She has become a leading voice in the patient advocacy space, driven by her personal experience with multiple sclerosis. Our other guest is John MacMahon. John is a graduate of Stanford University with a master's in electrical engineering and a bachelor's in physics from UC Santa Cruz. At Stanford, he was part of the biodesign program that brings together clinicians and engineers to identify clinical needs and innovate to improve patient lives and ease the burden on clinicians. On today's episode, John educates us on UVB light therapy for multiple sclerosis, and Kathy shares her experience using it. Kathy and John, thank you so much for being here with me today.
Thank you so much, Gretchen. It's an honor.
It's my pleasure. Thank you.
Of course. So just in case people don't know who you are, why don't we start off with some introductions and then we'll get into our topic of the day. So why don't we start with you, Kathy? Can you let us know who you are and what you have going on?
Sure. I'm Kathy Reagan Young, and I'm the founder of FUMSnow.com, which is a patient advocacy site for folks with MS. So I was diagnosed in 2008 and started that website in 2010 and a podcast in 2015, all just to kind of share my experience with MS and the fact that I think attitude plays a much bigger part than we give it credit for. And along the lines of interviewing people for that, all the experts that I've interviewed over the years, you were one of them. In 2018 was the first time you came on my show, and you were on there 3 times. So thank you again for all of that and imparted all of your wisdom. And since then, you've just grown this fantastic ecosystem of help and PT help for all of us in this community. And I just wanted to take this opportunity to thank you for that. Everything that you've done to help us. And you're one of the first people that I suggest people look up when, newbies, newly diagnosed come to me.
Oh, that's so great. Yeah, you have such a special place in my heart because you were actually the very first podcast that I was ever on. And I often think back to that back in 2018. I can picture exactly where I was in the apartment that I was living in at that time. And I remember it being echoey and like really embarrassed. I didn't have my good sound system up yet.
Well, here's a behind the scenes tip. I was sitting in my closet. That's where I was recording in those days. So
smart. Yes. Well, it's great to have you back on. Thanks for being here. And John, can you share a bit about you?
Sure. My name's John MacMahon. I'm a biodesigner by training. So that's the combination of engineering and clinical need. And I'm new to MS. It was only during COVID that we really started on this mission. So we really appreciate the opportunity to reach out to your audience. But I met Kathy as we were understanding how important sunlight is with respect to MS and how looking into it deeply may provide some really fundamental benefits to patients.
One question I have before we even get into our topic of sunlight and MS and all of that good stuff is, how did you guys meet? Like, how did you think to take what you've been working on and apply it to MS?
Well, that's a great question. So I was sitting on the board of a psoriasis company, and ultraviolet B band light, or phototherapy, is a prescription for psoriasis for decades. It actually won the 1903 Nobel Prize, right? Wow. How our body is in tune with sunlight in general, but in particular to this ultraviolet wavelength. And some of the results that we got for why I sat on the board of that company were just fascinating. And so I had thought about phototherapy on skin, sort of treating the skin, like where you shined it. But the results said that there was something much deeper going on, some some immune stabilization, some balance that we needed, that we got from sunlight, and just intellectually just stuck with it. And then COVID came, and it was a perfect test bed, right? So the virus didn't kill people. It was their immune system's overreaction, which is something that the MS community is profoundly aware of. That overexertion is what caused the fatalities in COVID. And so we tested it in a double-blind trial with LSU and Baylor and got some fantastic results. The vaccines came along, and so people, talked about, COVID's all solved. And we, from the research that we'd seen and the results we had, we thought, well, where is this needed the most next? And that's how we came up in reviewing the MS literature. So I think that's some of the background. And then we met Kathy through a group out of New York that did an introduction. And she's really been the voice of patients, educating us and sharing, how this can help patients looking forward.
Wow, I'm so glad that that overlap occurred because this is such a great population to utilize something like this in. Can we take a step back, a broader step, and can you let us know what UVB light therapy is? Because I think that's going to be important for the rest of the discussion.
Our skin has evolved we're really in tune with the environment much more than we care to admit. And our lifestyles have certainly changed over the past, 150 years to be more indoors. And the fact that we had grown accustomed to being outside, cyclical with sunlight, that our body adapted, particularly to a narrow band of light, sort of the highest energy photons, like sunlight suet, is ultraviolet B band light. And dermatology found over the past 100 years that you could balance the immune system by, instead of just telling people to go outside and try and get some ultraviolet light, but to use some lamps and actually provide it clinically. So it's a prescribed therapy. It's been in dermatology for decades. They've really done the heavy lifting and got it, super safe, super effective, easy to use at home. And we're really just translating it over to the MS and the MS patient population. So here's an at-home version. It's sort of 2 feet tall and about 10 inches wide. They now are, available commonly for dermatology, but some patients are using them in MS when I went on the podcast.
Me, I am joyfully.
It kind of looks like so my husband and I just got our gutters changed. They were really old and causing leaks. And while we had the gutter people fixing the gutters, we had them change out the light bulbs in a light that we had like really, really high up showing out towards the backyard. And it kind of looks like those lights, like really thin, cylindrical type lights, a lot of them side by side. So for those who are listening on the podcast and couldn't see it, is that accurate? It's just like a lot of bars of lights.
So you can make ultraviolet narrowband with fluorescent bulbs. So those are actually fluorescent bulbs. They're sort of a unique style. They double back on each other. So there's 4 in here. In this one, you can make them out of LEDs. You can make ultraviolet light out of LEDs. It's a lot more expensive to do. So the more common and the most developed products are these. This is made by Davlin. This is our manufacturing partner out of Ohio. But yeah, so it's a fluorescent bulb in that sort of format. So It clips into place if you ever had to change one, just like you would clip in a fluorescent bulb.
Okay. And so the idea is you have it sitting on a desk or on the floor somewhere near you, and you turn it on and you sit in front of it, or how would someone use this?
Well, Kathy, you're using one. I think maybe MS. Yeah.
Yeah. So I have now kind of gotten into a rhythm with it. And so I have a whole ritual now, but it's as easy as you turn it on and you stand there and then you turn it off. Truly, in its essence, that's it. what I have started doing now is, and by the way, you start, the protocol starts you at a very low amount of time. So I believe I started at like a minute on the front, a minute on the back, and I do torso and back, just flip like a burger and you're done. And then I just added the ritual of a little, some morning affirmation mantras, maybe some meditation. So I get it all, together at the same time. So after a time, you build up, and I believe the highest I'm at is 4.5 minutes on each side. So it's quick, easy. One of the things that I really like about it too is so often in MS, you feel done too. You feel like you've lost control. They're telling you need to take this drug and that drug, and you need to do this and you need to do that. It doesn't feel within our own ability to do anything for ourselves, to help ourselves. And that feeling of being out of control or just not having any say in the matter really pissed me off, honestly. And this gives me some semblance of control. This is something I can do for myself and by myself. I mean, that's the other thing. This is small. It's at home. It's light. I don't have to ask. Nobody has to drive me to a doctor's office. Do you know what I mean? There's all these ways that MS can strip you of your independence and feeling in control. And this is a way to add that back in.
Yeah.
I mean, I do it by myself, and I know that I'm doing something really good for myself.
I love that. That's like two benefits in one. You get the benefit of the light, but then also that confidence that so often that confidence just is ripped away from you.
Correct.
So I want to talk to you and ask you about the benefits that you've noticed. But before we do that, I want to know more of the science behind it. So what is the latitude gradient in multiple sclerosis? And most people might not have even heard of that phrase before. So what does that mean, and what do we need to know about it?
So the latitude gradient is something that came up in early MS research, basically since the 70s. And one of the reasons we're coming to the MS patient population is the neurologists, their clinicians, are taught during med school that MS has this latitude gradient. And the latitude starts at 0 at the equator, and it's positive and you go to the northern hemisphere, negative you go to the southern hemisphere. But a latitude gradient means the further you are away from the equator, there's much more MS. There's more prevalence. You'll get it at a younger age, and it'll be more severe. And so when we sort of take this concept to bring lights to treat a patient, the neurologist, especially the MS neurologist, are really, they're fully up to speed on the history and the need. We're just giving them a tool now to try and level the playing field for those that are in Buffalo. For example, I'm in New Hampshire, but you just can't get this. And so that's the geographical reference. And then further research has shown that it's actually the availability of this particular wavelength of light, ultraviolet B band light. It gets absorbed by the atmosphere when the sun gets low in the horizon. So for us in Buffalo and New Hampshire, when the sun gets low, we can't get really our normal dose of it from October to April. So how can you supplement that? And then in particular to Buffalo, Syracuse has the highest prevalence in the country.
Right.
Scotland has the highest prevalence in the world. Both have overcast skies, and those clouds absorb this frequency too. So that's sort of the background. Is the research has shown that all of these poor outcomes for MS, including getting it, is correlated with this level of light. So 3 academic centers around the world then said, well, let's go over to dermatology. Let's get some of those phototherapy lights and let's give them to patients. And that's the biggest kernel of science data. There's been randomized trials in Australia, registries, a randomized trial here in the US, and a registry done in Germany. All of them have shown terrific safety and great benefits for MS patients. But as academic centers, they turned them into papers and not into a therapy for patients. And that's where we're stepping in. We're like, let's level the playing field for patients that don't have this much, sunlight.
Right. So most neurologists that I'm aware of will prescribe vitamin D due to the lack of sunlight and just being further away from the equator. And we know that low levels are associated with MS. How does this type of light therapy compare to vitamin D? And I know you're not a neurologist, but would someone theoretically do both, or would this replace vitamin D? How does all that work?
So the concept, the data is real that if you have poor vitamin D levels, you have poor outcomes, whether it's MS, cardiovascular disease, rheumatoid arthritis, all of these inflammatory conditions. And the hope was that if you took supplements, you would bring up and improve those outcomes for patients. The past 3 years have shown in the literature that that's not true. It's not true in cardiovascular disease. It's not true in diabetes. So the hopes of vitamin D as a supplement have not really borne out to be the answer. The difference between low vitamin D and high vitamin D, what fills that gap? We're moving back upstream, right? So we're saying the natural level of vitamin D that you have that sort of predicts your severity, you need to overcome that by actually getting sunlight. So we have a patient in New York City. He's had progressive MS for 20 years. He's been taking massive doses of vitamin D. And he started using one of these lights he got a prescription, started using these lights. And he went into Mount Sinai and they said, "What are you doing?" Because your vitamin D that hasn't gotten up to 50 in 20 years has just jumped up. And so endogenously, meaning you can naturally produce not only the vitamin D, but there's much, much more behind it. And that in the science is really just speaking about your immune system. And we've really been at the forefront of that for a while. The inflammation just comes down. And so the vitamin D is going up in the patients in the trials, but their immune system, their inflammation is going down. And you can't do that with vitamin D alone. So in this patient's case, N equals 1, they've cut back his vitamin D supplements because he's naturally producing that. Plus he's getting all the reductions in inflammation.
Gotcha. Wow,
Gretchen,
that's
if
fascinating.
I just want to, if you don't mind, butt in for a second, because I think that's so important. I just want to underline that a little bit because I did not know that we could, in essence, manufacture our own vitamin D. That wasn't a conversation that was ever had with me, but that's in fact what you're doing in the sun. So that was a little mind blowing to me to learn that. And, it's these UVB rays that is making that possible. So to be really blunt, as you know, I'm FUMS, so of course I am blunt. I am now telling people that these vitamin B supplements are just making for expensive urine.
So I'm curious, have you had your vitamin D levels tested since you've started doing this type of therapy? And if so, has there been any change?
Yes, they have come up and stayed up, which was the other thing, because I would in my supplementation years, very high doses. And of course, my numbers would jump, but then we'd be worried that, is it hypercalcification? Worried about, kidney stones and whatnot. So then we dropped the levels and I was not maintaining anything. So I had to continually stay at this high level of supplementation, whereas I'm not taking anything. And now I've been using the lights. I'm staying up and stable.
Wow, that's amazing.
I have this patient's data that he shared with me and he said I can share it with him. So he started using the lights and in his tests were 4 months apart, his blood tests, and he doubled his level.
Wow.
And so they halved his dose. He was at 10,000. So, I mean, he was really taking a lot, in my estimation. One of our advisors has been, a lot of this research followed vitamin D, right? So we look at vitamin D levels. If you're not taking supplements, that's a marker for how much time you're spending outside.
Mm-hmm.
And so it's not the solution. It's just a marker. So you have to get some of the other sort of 30 naturally produced metabolites by getting sunlight directly. And metabolites are really changing medicine, right? So Ozempic is a metabolite. That's something that you naturally produce. It's an upstream solution. It's helping so many people across the board. And we think there's other metabolites, and we're actively looking for them in the data that we have from patients to really understand what's the upstream opportunity to, democratize health, but really to just fundamentally lower inflammation. And the MS patients are the most needy. They have the highest, signal because of this latitude gradient, and that's why we want to help them. You could, if their prevalence of MS that's in the southern U.S. was the same in the northern U.S., there'd be 300,000 less patients with MS in the United States.
Wow.
I mean, it's doubles when you move, just through the
Yeah.
U.S. from the bottom half to the upper half. And, there's so much to learn from this, because if we can help the MS patients and by reducing their inflammation, and one of the big things from all of these trials that showed up was the quality of life, right? So people are like, well, what's the inflammation mean to me? It's the fatigue and executive functioning was improved in these studies. And we think the science is that once you bring down the inflammation and you get the immune system to rest, then the MS patient can rest.
Mm-hmm.
And it's kind of a simple approach, but you need that. We all need to get some rest. And if our immune system can't, you can't really ask your mind and your body to do it on its own.
Yeah, so true. So, Kathy, I'm going to ask you the question that I feel like all of our listeners are wondering right now, which is, you've been doing this and you've said that your labs have improved specifically for vitamin D, but what have you noticed in terms of improvements, if any, on a day-to-day basis? Not just like what numbers tell you, but how you feel.
Yep. Well, let me just first mention that it's not just my vitamin D levels that have improved. Part of what I've been doing is this Octave Bio testing every 3 months, which looks at 18 biomarkers and really measures disease activity level. And I had started at a 3, which is good. But at that time, I can tell you I was in bed 4 to 6 times a day, still trying to working from bed and my recliner a lot, very tired, a lot of cog fog. And after starting with the light, I've been in twice now, and it has dropped to 1, which is the lowest level of disease activity. So
Wow.
It's not just, me and what I'm feeling or what I'm seeing. I mean, this is provable, right? And in terms of what I'm seeing and what I'm feeling, it's interesting. I had 2 people mention to me that it seemed like my energy level had changed. One was my daughter and one was a colleague. I don't think I noticed it because I was feeling like I should feel. So I think, at least for me, I don't think I'm unusual in this, that you notice more retrospectively that you have felt better, or right away when you feel worse.
Right.
But
yeah.
I didn't notice it right away. It took a couple of people mentioning to me that my whole sort of demeanor had changed and my energy level was higher. And I'm like, you know what? I'm not in bed 4 and 6 times a day. I don't need that anymore. And the cog fog had lifted. For me, fatigue and cog fog really go hand in hand. And as John mentioned, executive functioning, the overwhelm of that, the worry of that happening added on top of that. So that brought on anxiety. It's if this, then that, right? And it all improved tremendously. I feel a lot more confident in life in general, because prior to this change, I really thought long and hard before I went anywhere, because there were so many times where I would go somewhere and I would tell my husband, for instance, all my energy, I just felt it drain right out of my feet. That's how it felt. Like from the top of my head, it just went right out my feet. And then I'm shot. I mean, word fishing, I can't form full sentences. I'm exhausted. I really need to lay down. All of that, I'm just not experiencing that. And it's shocking, honestly. And when I think back to how I did feel and what I accepted as normal and what I have to deal with for the rest of my life, I'm mad. And I don't want anybody else to accept that either when there's something that can help.
Yeah, I love that. I love when not only you're feeling better, but also other people are noticing it, and there's proof from labs, like
Yeah.
actual proof from what's happening inside your body.
Exactly.
Wow.
Kathy really points something out that we're all very proud of with the group, which is this connection now through. So there's the biggest trial was done in Australia, and Prue Hart heard what we were up to, and they donated biobanked samples from their 30 patient 1 year trial, the biggest trial in MS and phototherapy, randomized trial. And we used those tests from an older trial, but we ran them through this Octave MS disease activity score. And we were the first to present this correlation, which Kathy is speaking about, which is the disease activity, inflammation coming down. And those are, objective biomarkers, and the fatigue coming down as well. So that correlation, and we were fortunate that Professor Obida presented that at CMSC this year, and it was nominated for the Neuro Innovation of the Year. Wow. So the hunger for the clinicians to say, hey, we know about this gradient, but we don't have anything to treat it. And the DMTs are doing great. You've got 24 options there to reduce lesions, to reduce relapses, but there's nothing that's addressing the fatigue. Mm-hmm. And so that is the trial that we've designed to go ahead and get a new indication, which is the silent symptoms trial. But we were really blown away that the MS community nominated. We were one of 6 to be nominated for that award. And Hearst did a review of the CMSC and brought it up as one of the big innovations. So we're really fortunate that the academic community and the scientific community see that we're trying to come at this for a solution that's really needed.
That's amazing. I remember I was at CMSC last year, so not this most current year. And I went to one of the lectures I was so excited for because it was all about fatigue management. And they basically called out all the different things that are currently used for fatigue, like different medications, different types of therapies, exercise. And long story short, at the end of the day, they basically were like, none of these are great. None of these are good solutions. Like, we need something more. And I left feeling like, okay, so there's some things that we could try. And more likely than not, it's a combination of things. But even then, there's not tons of great research backing it up. So it's really cool to hear that there's this new type of therapy, this UVB light therapy that can help specifically with fatigue.
And how fantastic that it's not another pharmaceutical.
Right.
I mean, I'm so sick of being handed another script with every symptom that MS presents me. No thanks, and then more side effects and no thanks for that. With fatigue is the most ubiquitous symptom in MS. I literally don't know anyone with MS that doesn't suffer, which is the right word to use here, with fatigue. And it's so life altering. There's not a part of my life that was not absolutely impacted by my fatigue. My mothering, my work, my social activity, my exercise, literally everything. Those things that you just spoke of that could help, the exercise, all of those things were altered by my fatigue. I couldn't exercise. So yeah, what has been presented to us in the past has, while I appreciate it, it really was not answering it. And it was also more pharmaceuticals, which none of us want.
Okay. So, how is this different, or is it different from just going outside? Like, could I just go outside for an hour a day and that would be equivalent to an hour of this sunlight, or not sunlight, but of this therapy? Or how do they compare?
That's a great question because there are sun habits that people can embrace with MS that they can take charge and get some benefits from. Now, you need to be the best data is out of Karolinska, so the lab out of Sweden, right? Nationalized healthcare, full MS registry. Dr. Alfredson presented at ACTRIMS their 15-year summary where they looked at patients and asked them their sun-seeking habits. Do you go outside? Do you avoid the sun? Do you go on vacations, sunny places? And in over 15 years, your EDSS score goes up. So your disability is worse if you avoid the sun. And your confirmed disease progression, worsening, CDW, that also is worse if you avoid light. Now, it's a bit of a battle because there's areas where you can't get it, right? Where you and I both live. It's not really available most of the year. So, but if you do live somewhere in the summer, right now it's, July here, you can go outside. UVB is really only available at the highest parts of the day. So that would be sort of 10 to 2 o'clock. So if you're walking your dog or going outside or going to the mailbox, if you shift that to being outside for 15 minutes in the noon sun with short sleeves, face and neck, your arms showing, then if in parallel with vitamin D, you could make enough vitamin D to be sufficient naturally. So those are sun-seeking habits. And one of the things that we offer is patients can opt in for information from us. If they give us their zip code, we'll give them we'll look up the UV index for their zip code and share with them, okay, here's what you can do to empower yourself to get some of these benefits. There's actually MS literature shows that if you work outside and you have MS, you live longer.
Wow.
So it's a very simple opportunity. But of course, we talked with some doctors at CMSC that were from Texas. And we were like, well, you have enough UVB. We want to do the trial in the northern half. Now, patients can get access to this through their provider. They can get a prescription for it. It's been indicated for dermatology for decades. So it is available for them. We don't have an MS indication. That's what we're going to do, but we have all the literature we can share and patients can talk to their provider and make a decision about getting access to it. But back to Texas, and they said, no, our dip in vitamin D levels for their patients is September and August. And I looked at him. That doesn't sort of make any sense to me. He goes, MS patients won't go outside in that heat.
It's hot, too hot.
It's just too hot. So this narrowband UVB it's like a tuning fork for your immune system. The sunlight is the whole band, right? But if you want that sound, that tune that's going to speak to your immune system, that's what the dermatologists have really as a gift to MS. They've done decades of research that you can get this without heating your skin, without any overheating. So you can treat, it's pretty much 10 to 1. So if you get a minute of these lights, it's 10 minutes of summer sun.
Okay.
So you're looking at Kathy's, and you'll start to tan at that frequency as your body adapts like it does. So you sort of 1 to 4 minutes is the regimen that you can incorporate. And I know in your podcast, you talk about incorporating routine, trust into your routine, getting, some mindfulness. And this is an opportunity to do that, to dovetail right into that approach.
So you could do your exercises in front of this light for 4 or 5 minutes and then turn around, do some more exercises. Do you have to do the front? I know, Kathy, you said you do the front and the back. Do you have to do that? Is there a certain protocol of how to best use the light, or is it just turn it on, sit in front of it for a certain number of minutes, then you're done?
Wherever you start is where you want to stay because you are tanning. So if you then turning the light up, you want to get as much light without any redness, right? So you really, the patient, after the very first treatment, the patient is in active conversation with, am I a little red? Do I keep going it up? Am I tanning? But you just want to be consistent. And so your routines that you showed of sitting in a chair and doing fatigue and leg exercises, those you could absolutely do. I use it therapeutically because I'm in New Hampshire. I just have it in the bathroom while I'm brushing my teeth.
Mm. So would you put sunscreen on before sitting in front of this, or does that block it or not affect it?
Well, I do mostly my torso.
Okay.
And because I'm taller than the lights, but you can, however you feel from a cosmetic aspect, you can put some sunblock on or just adjust how tall the light is, right? It's not very tall. I won't ask Kathy Kathy can say
torso and back. But no, to answer your question, I don't use any sunscreen. I think sunscreen's going to block it. So there's no need for that. And I want to just also mention, because I'm sure all the MSers out there have the same question I had, which the first thing I asked was, what's this going to do to my core temperature?
Yeah, absolutely.
Just have to be really mindful of that. And it does not raise it. Does not raise your core temperature. I'm not hot at all. So.
And I was only talking about the sunblock. Culturally, some people really want to have a, pale skin that they show to the public. And so that's where you would, if you were conscious that way.
Mm.
So you wear UV glasses, they come with the lights.
So how does this type of therapy, UVB light therapy, differ from red light therapy or infrared light therapy, or is it the same?
It's very different. And I enjoyed your podcast on red light therapy. This is about your immune system, just fundamentally. This is where all the research has been. It's just stabilizing your inflammation. You won't really feel this. Like red light therapy penetrates deeper into your skin. It feels good, right? Infrared saunas. I mean, that's good stuff, right? That's because it's going further in. The red light is improving your circulation. What this is doing, this is speaking to your immune system and your inflammation. So in dermatology, this works as good as the biologics, right? So patients can get these lights for $1,800. And in a big study done by Kaiser Permanente, they showed that 60% of the patients didn't need any pharmaceuticals after 6 months of using these lights.
Wow.
And that's a huge benefit to not have those patients taking Humira. And then once you're stabilized in dermatology, you don't need the lights anymore. So it's actually a bit of a reset of the immune system. And that's really provocative, right? The idea that you just need to reset the inflammation in your body to get you closer to normal, to give you less fatigue. And we think if you have less fatigue, your cognition is going to come with it. And so those are the things we're tracking for any patient that is reaching out to us and that we send to the light company. We ask them to do what Kathy's done, like do some good science with it, really understand your clinical need about reducing your fatigue, but back it up by doing these blood tests, and you'll help yourself and the next patient.
Are there any clinical trials currently going on that someone could participate in for UVB light therapy?
That's what was presented by Professor Obidot. So we're looking for the funding for that. We have some centers in the US. We have some international centers that want to be involved. So we'll hopefully get the funding for that shortly. But patients, like you said, because it's already FDA approved in dermatology, its safety profile is decades in the making, that patients can get access. They can come to our website, find the research that they can share with their clinicians, and they can start getting treated. We do have a proposal in right now with the FDA that we think there's sufficient data that it could be approved for pediatric patients off the data that we already have. And that would be terrific.
That would be. And it's really cool to hear too that it's something that you wouldn't have to do for the rest of your life every single day. Like you could take those breaks and stop at some point as well.
Yeah, so in dermatology, once again, we're taking something that's a well-established frontline therapy and bringing it to a needy group. You can go to a maintenance dose, which is in psoriasis is, okay, now once every 2 weeks, give yourself a treatment, and just keep yourself stable. And that's the learning that we look to do for MS patients too.
I love that. This has been so insightful, and I'm so excited to hear everything that you shared because it's basically an opportunity to reduce inflammation, improve energy and reduce fatigue, improve cog fog without a medication, and honestly, without moving. Like, obviously, I'm a huge fan of exercise and physical
Yes.
therapy, but that requires effort. And I'm not saying never to exercise, but it's nice to have an option that doesn't feel like a big ask. Like it's something that seems pretty simple.
Gretchen,
So,
if I
yeah.
can, I was not going to the gym prior to this. I mean, I wanted to. I would walk when I could, but I was so exhausted all the time. I, felt like I should all the time. I should go do this. I should go do that. And then I'd go lay down again because I was wiped out. I go to the gym at least 2 times a week now. I really work out. Aren't you proud, Gretchen? And and I live in Virginia Beach, so I am getting my son that way a lot now. I'm walking on the beach a lot. First thing in the morning because it is so blasted hot here in the summer. Same thing. I can't get too hot, so you got to figure out when to get out there. But in terms of wanting to suggest that people keep moving, 100%. But from my perspective, this is what allowed me to keep moving because I was too tired before. So kids are so important. And certainly when I was diagnosed with MS, the first question was, what about my kids? How can I help prevent them? Is there a way to help prevent them from getting MS in the future? And I'm going to hand this over to John because he can share more about what we know now that I didn't know at the time, but grandkids, well, I know now for any grandkids that might be in my future.
So the literature on pediatric MS, one of the big papers came out from the US Pediatric MS Network, and it showed that the risk for pediatric patients was strongest actually on how much time they spent outside, much stronger than if their parents had MS. So it's more important for these kids to get outside. Now, if somebody says, tell me exactly why that is the case, I can tell you that we know it's the inflammation is coming down, it's stabilizing their immune system. We think about it as a muscle that just like anything else when you're growing up that you need to exercise it. So you need to get outside and get this photo immune cascade going. But what they showed is if your children spend less than 30 minutes outside on the weekends as a baseline, compared to kids that spend 30 minutes to 60 minutes outside on the weekend, 30 minutes, that their risk of developing pediatric MS is cut in half.
Wow.
And if they spend more than an hour outside on the weekend, they can cut their MS, the risk of ever getting MS, 80%. It's just so provocative. And it's something that parents can do now with their kids today. You hear this podcast, you say, hey, we're going to go outside. We're going to go for a walk. Let's just start getting some healthy sun habits. Mm-hmm. And the benefits are they're for everyone, but they're most important for patients with MS.
So one question I have, because I do live in the Buffalo area, and I'm pretty sure Buffalo is like one of the highest cities in the United States of lack of sunlight per calendar year. So getting outside isn't always possible just due to weather, or if you do go outside, there is no sunlight. And even when you have MS, getting outside might be challenging. So obviously these lights, of course, can be helpful. What about sitting next to a window? Are the UVB rays blocked through windows, or how is that an option? What do we think about that?
Yeah, so Buffalo's a really important location for MS.
Yeah.
Anyway, what Dr. Jacobs did and Interferon and the Jacobs Institute that's there is really a terrific place, and as a translational medical center. So, but it's also home to the highest stroke rate in the country, some of the highest MS. Those are all inflammatory conditions. And, it's tough. You have so much lake effect overcast that the UV is really low. So, make hay while the sun shines. Get out there, wear a short sleeve shirt instead of a long sleeve shirt, but hopefully, reach out and we can get you on track to have your provider get you some lights. I mean, the risk benefit ratio for any light therapy is so in favor for the patients. And, the literature is just hungry for it. So should the malls in Buffalo, I know people, when I did some work at the Jacobs Institute for a bit, and, the malls in the winter are where everybody walks. Mm-hmm. Now, could you imagine them just setting up some UV lights there so you're getting both your exercise and some summer sun?
Oh my gosh, that'd be
why
amazing.
not?
Yeah.
Yeah.
Right near where
booth.
the bench is. Yeah, booth.
Yeah.
During your rest break, you get some light.
John just came up with a way to attract people back into malls.
Yes. There's one of the malls near me just closed because no one's going anymore. But hey, let's get them back in.
Let's put some lights in there.
But, that when we look at spas and wellness centers, but this is really a community health issue. Mm-hmm. So you really want to make it accessible, right? And we're trying to democratize it by working with Davlin to get them affordably at home, 2% of Ocrevus dose, and solving something that's entirely unsolved. And by the way, there's no incompatibility with any of the drugs. So you can be on your prescribed regimen. This is an add-on, and we're really thinking it's going to help fatigue. In the academic studies, it reduced relapses, but relapses are pretty well under control from DMTs. But what phototherapy did that no drug has done is improve your quality of life and reduce your fatigue. And we're hungry to bring that to patients, and I think they're hungry for it too.
So if someone listening wants to learn more about this, where should they go to either purchase their own potentially, or just look into the research? Where would you have them go to?
That's great. So they can learn more about what we're up to at www.cytokind.net, CYTOKIND. Right? We started trying to stabilize the cytokine storm, so that inflammatory disruption. So that's part of the name. And there they can log in, or there's an opt-in for them to give their name, their email, and their zip code. And so then we'll keep them up to date on our progress, but we'll also share with them some sun habits for their local community, because the amount of sunlight by zip code is available through NASA. And then daavlin.com, DAAV as in Victor, LIN.com. We have links off our website too, but that's the world leading manufacturer, and that's who we're partnering with. We've done all our studies have been with Daavlin lights, and you can go there on our website. You can also have the link that'll take you where your provider can get you a prescription, because it's the only wavelength that has the really the depth of research, but it's also the only one that's FDA licensed. So you'll need a prescription for it.
Awesome. Those sound very helpful. I'm excited I'll put all of those links in the show notes so people can easily find those. And Kathy, you have a weekly newsletter, and I know this because I've been receiving it, I believe, since 2018 when I started following you.
Probably, yeah.
If people want to sign up for that and hear what you have to say, which is always very exciting things, where can they sign up for that?
Yeah, that's at fumsnow.com/sixpack. You can just go to fumsnow.com too, because there's an opt-in right there. But directly, fumsnow.com/sixpack, and you will get the top 6 topics in MS for that week.
Awesome. Well, thank you both so much. I love having both of you on because it's really cool to hear the science behind this, but also someone who's actually utilizing it and sharing your perspective and the benefits that you've actually noticed. So thank you both so much for being here.
Thank you. Really appreciate it.